everyone, welcome to our second panel for Women's Health Week. To get us started, we'll introduce you to our panellists.
I'm Dr. Ash. I'm a GP at Bendigo Community Health, and I also work in the GPs in Schools program at Eagle Hawk Secondary. I use she, her pronoun.
Hi, I'm Marie. I use she, her pronouns, and I'm the Hay Diversity Worker from Headspace Bendigo.
I'm Bosca. I'm a sexual health nurse at Bendigo Community Health Services, and I use she, her pronouns also.
Hi, I'm Rebecca. I'm a community health nurse, sexual health nurse at Bendigo Community Health, mainly at the Eagle Hawk site. I use she, her pronouns.
So Bosca, what is menopause? Can you tell us about what age it starts at and the symptoms?
So menopause is the end of a woman's final menstrual period and is a change at the end of her reproductive age, with no bleeding, spotting or staining for 12 months. This usually occurs between the ages of 45 and 55 years of age, although the average age in Australia is between 51 and 52 years of age. The most common symptoms of menopause seem to be night sweats, hot flushes and mood swings and sleep deprivation. Blood tests are not a reliable form of confirmation for menopause due to the daily hormone level changes that occur within a woman's body.
Beck, we hear this word perimenopause. What does that mean?
Yeah, so perimenopause is a natural time which begins several years before menopause. It can last from a few months up to 10 years, and the most common age it starts is around 40. The reason it takes place because most women's ovaries, the organ that produces eggs, don't just stop working overnight. They slow down over a period of years, producing fewer eggs and releasing less hormones. The most common symptoms of perimenopause include irregular bleeding, bleeding for less days, sometimes could bleed for more days, and it can change month to month. So today I might bleed for 3 days and then may not actually have a period for another 8 months. So it's really varied during this period called perimenopause.
Thanks. And so Ash, some women experience a dry vagina after menopause but still want to have sex. What can they use?
So vaginal dryness is a really common problem affecting about half of all postmenopausal women. And one of the first and easiest steps you can take is trying a lubricant, and there's a few different options out there depending on whether or not you're using condoms. You can also speak to your healthcare provider about prescription medications for vaginal dryness. These include topical vaginal estrogen, or if you have other symptoms as well as vaginal dryness, such as the hot flushes and mood disturbance that Bosca mentioned, your doctor might recommend menopausal hormone therapy, which you might have heard referred to in the past as HRT or hormone replacement therapy.
Thanks. So Marie, how can someone find out about the sexual health and contraception?
It's important for everyone to be aware of where they can go for sexual health testing or inquiries regarding sexual health and contraceptive barriers protection. We have our sexual health clinic at Bendigo Community Health Services who are experienced in LGBTIQA+ inclusive sexual health. And we also have a sexual health nurse who attends Headspace Bendigo for our young people between the ages of 12 and 25. And she's also very experienced in LGBTIQA+ care. Thorn Harbour Country also works with the LGBTIQA+ community. So some people in the community can feel uncomfortable approaching a service when it comes to healthcare or sexual health and talking about body parts. But please be assured this is all private and confidential, and we have very experienced and trained staff who understand.
Thanks. And Ash, what age can a person start having sex?
So in the eyes of the law, it's illegal for anyone under 12 to have sex. If you're aged between 12 and 15, you can't have sex with someone if they're more than 2 years older than you. And if you're over 16, you can have sex with someone else over 16 as long as you both consent. So within these laws, there's no right or wrong age to start having sex. It's an individual choice. There's a lot of things to consider before making the decision to have sex, such as contraception and STI protection. But remember, no matter how old you are, it's never okay for someone to force you to do something sexual without your permission, and that you have the right to say no at any time. Sex can be a really tricky topic to navigate as a young person. And so if you'd like to have a confidential chat with someone about this, you can make an appointment at our Sexual and Reproductive Health Hub to have a talk to someone.
Thanks, Ash. So, Marie, does someone identifying as same-sex attracted need to have a cervical screening test?
Yes, any person with a cervix who is between the ages of 25 and 74 who has ever been sexually active, and that includes in a same-sex relationship, even if they have received the HPV vaccination, needs to have that cervical screening done.
Perfect. And another one for you, Marie. Where can someone go and get this cervical screening test?
So you can speak with your GP, nurse, or sexual health nurse regarding having a cervical screening. If you live in the Bendigo region, you can also contact our sexual health clinic at Bendigo Community Health Services for further information.
Cool. And Beck, what is endo or endometriosis, and how is it diagnosed?
Yeah, so as you just heard, endometriosis is a really hard word to say, so we actually abbreviate it down to endo. It's short for a chronic condition which cells from the lining of the uterus called endometrium are found in other parts of the body. The most common spots include in the pelvis and around the woman's reproductive organs, like the ovaries, fallopian tubes, the lining of your abdominal cavity, the outside of your uterus, and the ligaments that hold it in place. It can also be found in other areas, including between the rectum and the uterus, and also on your bowel and bladder. Endo affects 1 in 10 women of the reproductive age. These cells found outside the uterus grow under the influence of the female hormone estrogen, which you get a big surge of at the time of ovulation, which is when an egg is released from your ovary. This leads to inflammation and scarring as they remain in the pelvic cavity. It is not infectious, you cannot catch it or give it to anyone, and it is not cancer. The way you diagnose it is not easy due to varied symptoms, and it can take, on average, 7 years to be diagnosed. Your doctor or sexual health nurse will take a full history and ask lots of questions about your bleeding, how often, is there pain, or other symptoms you may be experiencing. Sometimes you may have a physical examination. An ultrasound does not usually detect small patches of endo. However, a specialist gynecologist ultrasound may detect larger areas of endo related to cysts or scarring. So really, the only way to get diagnosed of endo is by having keyhole surgery called laparoscopy by a surgeon and a gynecologist. During the operation, a small telescope is inserted into your pelvis via small cuts, usually in the belly button. This allows the surgeon to see and take samples to be sent to pathology to confirm at the time, and then they may destroy the endo cells or cut away to treat the disease.
Thanks, Beck. That helps a lot. So, Bosca, if a person has pain while having sex, is this because they have endometriosis?
This could be due to endometriosis, especially if it's situated behind the vagina and the lower part of the uterus. That could be causing it. But any pain that you might experience during sex should be really investigated.
Thanks. And Beck, again, I've heard miscarriages are common. Is this true?
Yes, it is. So a miscarriage is when a pregnancy ends before 20 weeks gestation. Most miscarriages, around 75 to 80%, occur in the first 12 weeks of a pregnancy. It is still today not a conversation women can have easily due to the grief and loss and some other reasons. However, it occurs in up to 1 in 4 pregnancies. It usually happens because the pregnancy is not developing properly, and the chance of miscarriage actually increases as you age. So, for an example, if I was a 20-year-old woman, I'd have a 10% chance, but if I was over 45, it's 90% chance of a miscarriage.
And for our last question, Ash, where does someone go if they are bleeding while pregnant?
So the first thing to say is that early pregnancy bleeding is really common and doesn't always mean that you're having a miscarriage. So 1 in 4 women will experience bleeding during the first 12 weeks of their pregnancy, and many of these women will go on to have healthy babies. So if your bleeding is heavy, you have severe pain, a fever, or are more than 20 weeks pregnant, you should present to the emergency department for assessment. Otherwise, you should make an urgent appointment with your GP. After experiencing early pregnancy bleeding, it's likely that your doctor will refer you to our Early Pregnancy Assessment Service, or EPAS, here at Bendigo Community Health. Through this clinic, we will organise and help support you through the ultrasounds and blood tests that might be required to work out what is causing your bleeding.
Thank you everyone for contributing to our panel. I'm sure lots of people will find those answers useful.